Health Matters now, a new bill could reform how Illinois handles the opioid crisis. Now, if it passes, it can have a big impact on the Peoria community. WMBD's Cameron Main breaks down this legislation.
The bill could change how the state handles opioid addictions and harm reduction strategies, especially around housing. Under the proposal, any homeless shelter that receives state funds cannot kick someone out of the building on the sole basis of a drug sobriety rule. Most housing for the homeless in Peoria have a sobriety rule. The state representative championing this bill says Illinois needs to rethink how it handles those with opioid abuse disorder.
Drug use, misuse, addiction, it is a health issue. It is a health issue, and it requires a healthcare approach. And in fact, that's what the research and data shows.
In Peoria, a harm reduction nonprofit known as JOLT helps those with severe drug addiction. They hand out clean syringes, life-saving Naloxone, and support people in their path to recovery. The executive director of JOLT, Chris Schnaffer, says this legislation could save lives.
What we find is that when people are not housed, they're in survival mode, and so they're not thinking about planning ahead and how do I get out of this poverty that I find myself in. They're worried about just surviving every single day.
The bill would also change how the correctional system handles opioids. It would require all prison and jail staff to have Naloxone ready available to save those incarcerated from overdoses. It would also require correctional facilities to give out opioid use disorder medication.
They're put in jail or they're sentenced to prison, and then they go through these really inhumane, suffering withdrawal symptoms without any medication to alleviate those or to help them manage those withdrawals.
Schnaffer says more funding to harm reduction groups saves taxpayer money by reducing hospital costs and reducing police calls. Reporting in Peoria, Cameron Main, WMBD News.